Hello, we have Houston, Texas-based cosmetic surgeon Dr. Nikko joining us to answer a few questions about blepharoplasty. Our first question comes from Christina, who wants to know, can it be performed under local anesthesia?
Hi, Christina. Thank you for the questions. Blepharoplasty, or basically eyelid surgery, there's two types. One is the upper eyelid, and the second is for the lower eyelids. Now, typically, the upper eyelid requires skin excision. So a lot of people feel that their skin is hanging their eyebrows, their lashes a little bit, and when they put on makeup, it smears and they can't get the eyeliner on. And a lot of time we can just excise a little skin. And typically that can be done, surprisingly, under local anesthesia without general anesthesia. We'll give you a little oral sedation of value of some type. A lot of people handle it well. So I think that that is a great option. Now, for people who are considering blepharoplasty or eyelid surgery for the lower eyelid, that is a little bit different story because the lower eyelid is a little bit more complicated. We have to be a little bit more invasive. We have to go in most of the time to remove fat pads for people with bags underneath their eyes, to remove those fat pads. And typically those procedures are a little bit more uncomfortable with just oral sedation. So typically I like to do those under general anesthesia. And the type of anesthesia typically is not really deep anesthesia, but it is general anesthesia. And the procedure, if done under general anesthesia, can be pretty short, 45-minute procedure, so not too long at all. And if you're considering doing both, then I would recommend obviously doing both under general anesthesia for your comfort.
Okay, great. Well, our next question comes from Cecilia, who says, I've been considering eyelid surgery for many years and have finally decided to move forward with the procedure. I'm currently in the process of looking for a surgeon and have some questions. Will it affect my eyesight, number one? And where are the incisions and are there scars?
Okay, Cecilia, if you're talking about upper eyelid surgery, now, typically, upper eyelid surgery improves vision because you're removing that hooding that's preventing you from seeing upward. So you should see an improvement in eye vision. It shouldn't affect your visual acuity or your vision or how sharp your eye sight is because we don't go anywhere near the cornea or the eye structures itself. Now, if you're doing lower eyelid surgeries, of course, there are a little bit more potential complications. Nerve injury, muscle injury, those are very rare, but it can happen. So if those happen, of course, then you can talk about, yes, it can affect your vision. You can get double vision or just an inability to see at certain angles. So there are possible complications with the lower eyelid surgery, but they're very, very uncommon.
Okay, Joan asks, what concerns should I have post-surgery? And will it last forever?
Yes, I believe Cecilia asked me a question that I didn't answer before, so let me just go back. She said, where are the incisions or where are the scars? So the incision for the upper eyelid is actually in the crease itself, so you don't see any scars. The lower eyelid surgery incision is right below the lashes, so it's really well hidden, okay? So I just want to kind of get that out there. And so I'm sorry, so what was Joey's question again?
So Joan asked, what concern should I have post-surgery and will it last forever?
Yeah, that's a great question. Will it last forever? I think every patient are looking for a procedure that would give them great results, minimal downtime, minimal risk, and last for a long, long time. So I do have patients that come in and say, will it last forever? And which is a kind of a funny question because no surgical procedures is gonna last forever. Unfortunately, we're born with a body that continues to age, and if you take care of it, it will age more gracefully. If you have bad genes, or you've been out in the sun, you don't take care of it so well, you're not going to age so well. So even if you do take care of yourself very well, age is going to catch up to you. So nothing lasts forever. So you're probably asking, how long does it really last? I find that if you do an upper eyelid surgery or a lower eyelid surgery on a patient, it's very unusual to have to repeat unless the first one was done incorrectly. For example, maybe not enough skin was taken out. On the upper eyelid, we can use a little bit more. Later on, maybe if the brow droops a little bit and there's a little bit more skin hanging over the upper eyelid, we can excise a little bit more. But there's a limit, because if your brows drop very low and we continue to excise skin, then your eyebrow is going to be pretty close to your eyeballs, and we don't want that. The lower eyes are interesting because there are fat pads that come out, and a lot of time when I find that patients come back for redo, it's typically because during the first surgery, the eyelid surgery, probably not enough fat pad or inadequate extractions of this fat pad occur in the first place. Because if the procedure was done correctly in the first place, really you don't want to remove more fat pad, because as we age, we tend to lose volume and we tend to become more sunken in. So removing more fat pad is going to really cause that to be a problem, and you look more aged. So typically when I do eyelid surgery for patients, I say it should really last for a long time, given if everything is done correctly. Have I done a patient that had to be done again? Yeah, of course. I mean, not every surgery is perfect, but in general, it should last for a long time.
Okay, this last question comes from Ashley, who says, I've been looking online and I haven't seen anything directly stating how much it cost. Can you give me an idea of what you would charge me?
Yeah, that question can be answered more directly, because it's unlike liposuction or tummy tuck. There's a broad range, but typically upper eyelids, if done without anesthesia and you done under local, typically it can be done for a couple $1,000s. Lower eyelids, and because we have to add anesthesia and OR cost, then you're looking at about $4,000, because of just the fact that we have to have more anesthesia involved and OR fee involved.
Okay, great. Well, thank you, Dr. Nikko, so much for answering these questions concerning blepharoplasty.
Well, thank you very much. I appreciate everyone's questions, and I hope that answers some of your questions. If you have more questions, please post it online. I'd love to answer them. I know this can be a confusing topic. I know many people have seen eyelid surgery that may not turn out as well, and so I can answer any question or any concern you may have, or you can call our office at 713-960-1311 and come in, and I would just love to sit down and talk to you.